Assalamu alaikum wa rahmatullahi wa barakatuh. In accordance with the series of talks we've been presenting, trying to offer some basic facts, especially from the point of research and medical knowledge with regard to the current epidemics or pandemic facing the global, the world. So we had some requests from people who have been following the earlier talks that we've talked about a lot of details on how this disease is being transmitted. So what are the preventive measures? Talk about now about basic preventive measures for general people, and then subsequently we're going to talk about preventive measures for healthcare workers. So generally it's recommended that if somebody has to cough, then you should cough over his shoulders so that the cloth is putting on, or the dress or the garment will absorb the viruses and then to limit the spread. And so that is generally for somebody who is coughing or sneezing. And so initially there's a lot of talk about face mask, but initially the WHO have brought out a publication to say that there's no actually evidence to show that or to suggest that the virus survives in air. So that's about 2 weeks ago. There's another report from WHO reversing that stand to say that now we understand the virus can actually survive up to 8 hours on air. So it is feasible to contract it by inhaling the contaminated air. So that's when generally they recommend use of face masks. But I must say at this point is for general people who are healthy, who are not in crowded places, who are not high-risk areas, putting face mask might not be necessary. If it is available, fine. One can use face mask for the advantages that, one, it reminds you not to pick your nose or touch your mouth, or it will also tend to remind you that, look, you are trying to avoid something serious. But most especially, the face mask is necessary for somebody who is sick, or who is coughing, who is sneezing, or somebody who is a healthcare providing care to either the sick ones, so that we do not transmit to them. The original purpose of using face masks, especially the common face mask that we see, the green, white, with the green and the white surfaces, is basically to prevent the spread of infection from the healthcare provider or person putting the face mask to the other people. It's actually not designed to prevent the wearer from contracting from illnesses or viruses. But in this case, if somebody is worried, you can put the face mask, but generally it's not recommended for general populace. Now, hand hygiene. Hand washing, one should wash his hands regularly with soap and water under a running tap, and use hand sanitizer frequently as well. That tends to wash the virus, reduce the viral load on the hands, and the soap tends to dissolve the surface of cell membrane of the virus and then give over some protection. Social distancing is something that is quite encouraged. Avoid close contact with people, especially people who are coughing and sneezing. But generally, because we know there are people who are called asymptomatic, and they stand the risk, or they are capable of spreading the disease to people who are not affected. So that's why you need to distance yourself from other people, at least the minimum of 2 meters. And if you have to be with somebody, shouldn't be for a period longer than 15 minutes. So then any other thing that somebody have used should be disposed adequately. Like if one cough on a tissue paper, should be discarded to a waste bin. And after this, wash your hands with soap and water, and then use hand sanitizer as much as possible. Then for the healthcare workers, the normal standard precautionary measures in dealing with specimens and patients should be adhered to. In our subsequent talk, we're going to focus on healthcare providers. How are they going to use these preventive strategies? Thank you very much for your time. Assalamu alaikum.